I'm Dr. Kay Durst, and I am a family medicine doctor, and right now I'm the president of the Charleston County Medical Society, and it's an honor and privilege to help serve the physicians in our community. We've worked together having our mentorship with the students and residents, and that's great. There's a lot of evidence actually out there through the different organizations that show if you can have a mentor or peer, you decrease physician burnout, and that's a very important part right now. And knowing that trust and knowing that this peer went through what you did through the residency and the hours, and maybe understanding where you're coming from is very helpful. We can really advocate together for whatever it needs. Maybe it's the burden and the EMRs, or even just knowing how to deal with the case, or just, again, having just fellowship. Maybe the new physicians are having a little bit of struggle as they're having kids, having families, who they can turn to that work full-time and then have a family. So it's a great opportunity to be involved. Well, I think it's so important, especially when you're new, to join an organization, because your training was like that, so you're around some people, and then when you're out and new, if you were employed hospital, you do have some camaraderie there. But if you're in the medical society, it's all different specialties, all different hospitals, private doctors, so you get some of the good support. I'm kind of a mix of the old school, I went to medical school, there weren't many computers, to now I'm developing some stuff and working with some people doing AI in medicine. I think that's very important. I think in developing through the CCMS, if we have artificial intelligence, working with a lot of the students that are the residents or the students that are coming out, they have great innovative ideas. How can we make medicine better? Now we do Zoom meetings, so that's good. We have our medical mingles in person, but that's important. We've even developed some new ways that answer the phones, where we have a Cynthia that helps us. We welcome to have new membership with new ideas, bridging the evolution of our history, remembering that, but being progressive and going forward for new ideas to help the new physicians. CCMS has a great number of committees that are involved, and we'd love to have more people involved, some more ideas and some more movement forward and taking action to help develop these committees. I've been involved with different ones, but as the president, kind of oversee them, and we have our board members then are in charge of the different committees. So as I mentioned, we have our ethics kind of committee. We have a public health committee that helps deal with going on like different vaccines or different pandemic. We have the committee on the school health and wellness, which is really good. We have the medical legal kind of advocacy committee that's very involved also. We have the women in medicine committee, where we've done different social things, where we've brought in different speakers and had different events. And our service committee that we have, public service, and that's very important. CCMS stands for the Charleston County Medical Society, and we founded since 1952, and we've been around. We would love to have medical students, residents, and any physician that can join us.